Hi, I'm Dr. Amy Myers. Today I want to talk to you about a supplement that I think everybody should be taking, and that is probiotics. So I'm excited to announce that we have some new probiotics that are now shelf stable that do not need to be refrigerated, and it's been a game changer for all of our patients. So what is great about these probiotics? Well, we have two strengths. We have in a capsule form, in a bullet pack, we have 100 billion units and 30 billion units. And then we have individual satchels of a powdered 30 billion units. So the reason that we switched to these probiotics not only is because they're shelf stable and it has been a complete game changer for everybody, all of our patients and people, buying off our stores, so excited about these, but really they have had extensive research done on 4 really key strains that are in these probiotics. 2 are from the Lactobacillus family and 2 are from the Bifidobacter family. And these 4 strains have been extensively researched to both help promote, gut healing and the immune system. So the 30 billion unit is what I recommend for children and for those who are just looking to maintain gut health. And again, we have that in a pill form, in a capsule form, or in a powder form. That can be great. I use that for on top of my dog's food too. So you can share it with your pets when you get the satchel. The 100 billion unit I recommend for those people who are really trying to overcome leaky gut. Maybe they're healing from Candida overgrowth, from a parasite. We recommend a different probiotic while you're healing from small bowel bacterial overgrowth, and I'll talk about that in another video. Or anybody with sort of a chronic condition like an autoimmune disease, Crohn's, ulcerative colitis, that type of situation. So the 100 billion is for those who are actively sort of dealing with either a chronic health condition or something going on in the gut, and the 30 billion is used for children and for sort of daily maintenance. So the pills with the 100 billion units, again, depending on who you're working with, if you're just buying them off our website, I'd recommend 1 a day. Certainly I've gone up to 2 a day with certain of my patients, but I'd want you working with either one of my registered dietitians or of course someone in my office or another practitioner for that. So again, 100 billion units, 1 pill a day, can be taken with food, without food. I often will throw mine, the capsule can be broken apart very easily in a blender. So often I'll just throw that again if I'm doing a smoothie or something that day. The 30 billion units is again either a satchel or a pill, and that can be taken twice a day. So that would be a total of 60 billion units if you want for that particular. So as I've mentioned, in terms of leaky gut, maybe if you've watched any of the other videos here or listened to anything that I've done, the gut is the gateway to health, and we are really trying to heal leaky guts for many people with chronic health conditions, and part of that is removing the infections in the foods, re-inoculating, which is with the probiotics, of course, and then replacing and repairing. So again, I think everybody should be taking a probiotic. We are just living in a world that has been bombarded with antibiotics, whether it's in our food supply, in the soaps and lotions that are being, used out there, or even just oral antibiotics that people are taking, babies being born by C-section, not being not being breastfed, but rather bottle fed. So nowadays, I think everybody pretty much out there could use a probiotic. So the 30 billion for maintenance or someone who doesn't really have a chronic health condition, 100 billion for those of you with chronic health conditions or someone trying to overcome leaky gut or some type of infection like yeast overgrowth. All right? Hope that helps.